Prostate cancer is a silent killer, and a routine checkup can save your life. With this simple yet highly realistic reminder, the Peter Latos Prostate Cancer Foundation, along with world-renowned prostate surgeon Dr. David Samadi, has given men in New York and its outer regions the opportunity to check their prostate for free.
We're here today to draw blood for prostate cancer in memory of our friend Peter Latos, who passed away a number of years ago, sadly, and he's trying and his foundation are trying to save young people's lives, taking a simple blood test.
I'm here to honor the foundation and the Latos family for making sure that they want to continue the legacy of Mr. Peter Latos.
The interior of the well-known Astoria's Cavo Lounge was transformed into an organized temporary medical center to administer the prostate-specific antigen PSA exam.
Actually, it was a very easy exam. It basically takes about 20 seconds where they would draw your blood and then they will send it to the laboratory and you will receive the results within 7 days. Hopefully the results are good and the life will go on.
The test was a very simple test. The order and the conduct in which it was done, the manner in which it was conducted was pristine. It was excellent. It took not longer than 5 minutes, and all the attendants, all the nurses, the doctor, Dr. Samadi, who is here, have been extra cooperative in this very pleasurable process.
As Dr. Samadi stressed, prostate cancer shouldn't only be considered a sickness for the elderly.
Get your baseline PSA at the age of 40. And if that number is over 1.5, then you need to be aware and be concerned. Always ask a copy of your blood test from your doctor, because nobody is going to be a better doctor for you than yourself. That's a big message.
I think it's a common misconception that if you're young, it's less likely for you to get certain illnesses, but that's not true. You should always get it checked even though you're not in that age range.
The case of the late Peter Latos was clear evidence of this, as he was diagnosed with a late stage of prostate cancer at the young age of 42 and eventually succumbed to it only 5 years later at the mere age of 47.
U.S. guidelines tell them, wait until you're 55 to get it. So they want to get it younger and they want to be covered. And so today we're doing it for free so people can know what their baseline PSA is, and if it's elevated, they can do something about it and potentially save lives.
Peter Latos not only never made it to 55, there are a lot of people like Peter Latos out there who have prostate cancer. They don't know about it. The doctors are not going to draw the blood because it's not recommended and you would never know. So that's the whole purpose of bringing awareness to the community.
The Peter Latos Prostate Cancer Foundation organizes the PSA free testing event every year in continuation of the initiative begun by the late Mr. Latos when he was still alive.
Today is a very important event. We are hosting a free screening for males for prostate cancer. We're taking blood here and we're checking males' PSAs and making sure they're not high enough where they will be diagnosed with prostate cancer. And also on June 11th, we'll be hosting our second annual gala event for the Peter Latos Prostate Cancer Foundation, and we hope to see you all there.
The gala is going to be held on June 11th at the Crest Hollow Country Club in Woodbury. Every year, this is our second year, and last year was a tremendous success. Every year, our goal is to raise a lot of money and to put it towards prostate cancer research, trying to find a cure, and trying to educate young men about the importance of checking their PSA.
I love Peter. He was not just my patient. I treat my patients truly like a family, and I get to know them. With Peter, I became a close friend. And anytime he had a problem, he always used to text me. He brought a lot of positive energy to the practice. Everybody loved him. He comes in with his ripped jeans and, well-built, and was always about beating this disease and positive and moving forward.
The PSA test is considered painless and is no different than a routine blood test.
Prostate cancer is a silent killer. There are no symptoms, and by the time you will have the symptoms, it's already too late. Don't go the route that Peter went without his choice.